So today we will try to understand in brief about TMP, tympanic membrane perforation. So at the basic level, it's literally a hole or tear in the eardrum, and which even makes the ear more susceptible to infections. So overall, what can be the different causes? So what can actually make a tear in the eardrum? There can be various infections. The most common that you might come across is acute otitis media or even chronic otitis media, or there can be some kind of trauma, or like pressure changes trauma called as barotrauma, or there can be a direct injury, like people who use the cotton swabs or pencil pen, those kind of trauma, any direct injury, or it can be acoustic. Acoustic trauma is from loud noises, explosions. You have been to some places. Yeah. So these can be the trauma, or because of some medical medical procedures. Those medical procedures like laryngotomy. So laryngotomy is done intentionally. Intentional perforation of the eardrum is laryngotomy, and first, other is ear irrigation. So while if if you have done something that needs ear irrigation, then accidentally your eardrum can get perforated. So yeah, these two conditions comes under medical procedure. The other can be because of neoplasms like tumors, any kind of tumors that has been growing into your middle ear or the ear canal can cause this. Um, yeah, these are the causes. Now the management. How can we manage? First, we need to observe. We need to observe. If the perforation is small, uncomplicated, then it will heal spontaneously on its own, and it's usually observed for week to months. And it is advisable to not poke your fingers or do something. Let the ear be. And second we can do is the medical treatment. The medical treatment is, of course, antibiotics are given to keep the infections at bay. And pain management. For pain management, we do give analgesics. Okay. Third, we can do surgically. Surgically, we can do myringoplasty. Myringoplasty. Okay, repair of the tympanic membrane. Or we can do tympanoplasty. It's a more, so tympanoplasty is also repair of the um, eardrum, but in a more extensive procedure, and it also addresses the middle ear and not only the eardrum, also the middle ear structures if they are damaged. So myrinoplasty and tympanoplasty, or we can do ossiculoplasty. Ossiculoplasty is the Ossicles, reconstruction of the ossicles, repair of the ossicles. Ossicles. Okay, ossicles are no the small bones of middle ear. Okay, and also along with these, we have to take some uh, precautions or preventive like prevent water retention or water entry. Okay, while you take a shower or something, keep the area dry. Patient. Yeah, this will also prevent infections, and there should be a regular going to the clinic for ear checkups. Okay, ear or you can say hearing checkups and follow up thereafter. Now, what can be the complications? Complications of tympanic membrane perforation. What can be? So, of course, there will be as we first talked about this infection. So, if you have even if your ear is perforated, this tympanic membrane perforation can lead to chronic otitis media. Okay, of because of infections this happens. Otherwise, of course, hearing loss because yeah, it depends upon the degree of how your ear is perforated or cholesteatoma. So the cholesteatoma is abnormal skin growth in the middle ear. So abnormal growth happens at the middle ear and it doesn't heals properly. So these are the complications that can develop. So management should be taken as soon as